and get into the second part of chapter 6, the integument. And with that, we're going to discuss, all right, the structures that are derived from the epidermis, or what we call the epidermal derivatives. All right, so some of the things, and we've talked about nails and hair and the glands before, but if I didn't emphasize it enough, let me emphasize it now. Those structures, even though some of those structures or parts of those structures aren't found entirely in the epidermis, right? These structures do come from the epidermis. So we refer to them as epidermal derivatives, right? So we're going to go through these, and we've already talked about a lot of them. So some of this is going to be review. So when we're talking about the nails, and I know you've seen this slide already, so I'm just going to kind of skip over this part and go right to the picture, because I feel like the picture will be much more helpful here as we move through some of the materials. So when we're talking about nails, all right, one of the things that you should understand is the nails are an actual modified portion of the stratum corneum. Right? And it's been modified to become much harder, more rigid, stronger structure. And so, as you know, our nails help to protect the distal portions of our fingertips and the distal portions of our toes. So not only do they have protective function, but we also will use them more so in the fingers. I don't know too many people that use their toenails, but for grasping things. And I've used the example before, if you have to pull a splinter out, or if you're trying to maybe get something out from in between your teeth, all right, people will use their fingernails to help with that. Okay, so when we're talking about the nail, what I really should be talking about is going to be the nail plate. All right, and the nail plate is the entire portion of the nail itself. So you'll see here the actual entire hard structure here, that is referred to as the nail plate. And there's three parts to the nail plate. There's the part that we don't see, okay, and that's the nail root. And then there's the part that we do see, all right, and that's going to be referred to as the nail body. And the very tip of the nail body is going to be the free edge. That's the part that you cut off. All right, and it appears white because there's no underlying blood vessels, specifically capillaries, underneath. The part of the nail body that you do see exposed that has coloration underneath, right, that is because the capillaries there are providing that color underneath the nail plate. And so when you want to do a quick assessment of somebody's blood flow in the distal portion, All right. I have no idea what happened there. So, and I know I'm back. We can't learn about the fingernails today. Well, we need to learn about the fingernails. We need to find out all that there is to know. I apologize. I have no idea. I don't know if there was a momentary pause um, in my internet connection, but it looks like, let me just double check here and make sure that this is recording. Okay, we are recording. Okay, anyways, I hope it didn't record any of the curse words that I was using. Just kidding. Okay, so continuing on with left off on the nail body color. Okay, yes, that's right. Thank you very much, David. I appreciate it. It's good to be back. It's good to be the king. Okay, so keep in mind that that's one of the things that we utilize when we want to see how well some of the circulation is going, especially in distal structures from the heart. All right, we just do the capillary refill test. Press down on the nail bed, release pressure, and then it should instantaneously, within just a second or two, refill back and return to its normal color. If not, if it takes longer than 10 seconds, then we have some concerns with the circulatory system. And so we can address certain concerns there. All right, so some of the other structures that you'll see here, right, when we're looking through the fingernail, okay, you'll have your nail folds. Those will be on the lateral portions, right, on either side, okay? Hey, can the nail stop growing if the root is gone? No, if the root is gone, it will continue to grow. It's the matrix. The matrix is going to be the part where we're going to see the actively, that's a great question, by the way. The matrix is going to be what is going to generate the nail root. So if the root is gone, like if you were to just rip out the nail, then the matrix has to start over from scratch. So no matrix. Yes, the as long as the matrix is present and it's undamaged, then it'll continue to produce the root there. Great question. So you'll see the nail folds on either side of the lateral borders here of the nail. And you'll see this white portion here, that's the lanula. And the lanula is a crescent-shaped whitish region here under the nail plate. And it's going to have that white appearance because the tissue there is thicker. So it'll obstruct the capillaries that are underneath it. You know what, folks? I have no idea. This could be an issue on the Zoom issue, because I know that my internet is still working. It might be spotty. I apologize. I have no idea what's going on. I won't let it throw me off my game. Let me continue on here and not waste your time. All right, so the cuticle, also known as the epiconium, that's where the tissue from the skin here comes on to the proximal portion of your nail. And then if you look here on the lower picture down here, you'll notice, all right, that the nail itself will sit on this living epidermal tissue, and that's referred to as the nail bed. My power has been in and out today because of the rain, so I'm there with you. All right, yeah, I don't know what's going on. I mean, I'm going to be honest with you. I have not had any problems with my internet or power today until, of course, 6 o'clock rolls around when I actually have to teach. This is one of the disadvantages of teaching from home. I'm reliant on my home network and power and all that instead of the school. And then finally, you'll notice where the free edge of the nail overhangs the distal portion of your finger. All right, you have a small area right under here, all right, called the hypochonium, and that's just a thickened area of your the stratum corneum. If you were to cut the nail too short, you would be able to see that pretty easily. All right, so that's it for the nails. Come on now. All right, that's it for the nails there. Covered all that. All right, so a couple of the things that we're going to discuss, and I mentioned this before about when we're talking about nail disorders and the overall health of nails. All right, Brittle nails is something that some folks might see, in which you'll see what we call vertical splitting of the nail or actual separation of the layers of the nail. Could be a malnutrition disorder that could be causing that. One of my least favorite type of nail disorders are ingrown nails, especially you'll see that more so in the toenails there, in which that free nail edge, more so on the lateral portion, will actually start to grow or dig into the skin. Some folks have suffered from onychomycosis, which is a fungal infection. Right? Onychomycosis is a tough one to treat because it takes a long time. A lot of medications, there's oral medication, there's also topical medication that you can use. The oral medication normally will take up to 6 months. You have to take these pills for 6 months. The topical, depending on what type of medication, you'll just apply directly to the nail itself. But then, again, it takes a while for all that to occur. All right, yellow nail syndrome, all right, when you'll see, all right, discoloration in the actual nail plates, right, when the nail is growing and as it's thickening, it'll start to slow down so that yellow coloration occurs. And usually when you see yellow nails on folks, you can kind of tell that they have, all right, a decrease in the growth and thickening of the nail plates. Spoon nails, interesting, okay? Here's the finger, and the nail will kind of have this big kind of curvature, and it has this convexity to it. I mean, that looks more like a dog nail, but exaggerating a little bit. In a situation where you see some spoon nails, you should start to think of cardiovascular issues there. Bowlines, all right, something will occur with the actual nail growth, and so you'll see the nail like this, and you'll see these lines here. And then also you'll have vertical ridging. Okay, you might even have it on your nail right now. If you look closely, I've had some of these, right? Normally it's nothing, okay, but you'll see those vertical lines in the nails, right? And it's just, for the most part, something that we're not too concerned about. Making my way up there. Again, pitting can be one of those things in which you get the indentations, and usually the pitting can occur from trauma. A lot of times, if when the nail is still at that point with the nail root, and as it starts to grow out, so it's either going to be trauma that was experienced by the nail during the root phase, because it takes a little bit more trauma to actually see some pitting going on in the actual nail plate that's visible. Most of the time, and for whatever reason, when I see issues with the nails, it's either going to be, right, some sort of deficiency, malnutrition, trauma, or I start to get concerned with cardiovascular issues. Those are the most common ones. Hair, the next epidermal derivative. Okay, as we know, you're going to find hair pretty much all over the place, except in certain areas, all right, like the palms of your hands, the bottom of your feet, all right, on your lips, all right. Hopefully you don't have hair growing from your lips, certain parts of the external genitalia, okay, and, all right, we're not really going to see it on the sides of your feet and toes also. So when we're talking about hair, the book uses quite often this term here, pilus. And that's what we actually call a single hair, right? And for the most part, our hair is going to be made up of keratinized cells. What does that mean? That means those cells are dead, and they'll come right from the hair follicle. All right, so there's 3 types of hair. We have the lanugo hair. That's that downy, fine hair, right, that will appear on the fetus during the last trimester. So after the fetus is born, right, and then over time, that hair will change into that vellus hair. So the only time you see the lanugo is going to be in that last trimester, and then at the time of birth and shortly after birth, it transitions into vellus hair. And if you do come across somebody that's an adult with lanugo, right, the only time that I'm aware of that being present is folks with anorexia nervosa. For whatever reason, this hair will revert to lanugo hair. All right, vellus, this is the hair that you're going to find on your arms and legs. Okay, you'll also see it. Sometimes it's referred to as peach fuzz. Okay, so you might see it on the back of somebody's neck or on their cheeks. Okay, but that is our primary hair. The terminal hair is the one that more people are concerned with, especially if they have to go to the barber or to the beauty salon. Yes, me too, Tanya. I don't know why this keeps happening. I do apologize. I have no idea how long I was out. Let's do this. Hold on one second. Okay, let's try this one more time. Pull this up, come back there. Okay, so the terminal hair, again, this is going to be the coarser hair. This is going to be the hair that has color because of the melanin content, right? It's found on your scalp, your eyebrows, eyelashes, and for men, we find it in our beards. And then also, we are going to replace the vellus hair with terminal hair during puberty in our armpits and also in our pubic region there. All right, so when we're talking about a hair, there's three parts to the hair. The base of the hair, all right, where it kind of swells out a little bit, that is the hair bulb. And then our hair will extend up towards the surface of the epidermis to the surface of the skin. That part of the hair is known as the hair root. And then we'll see, okay, the actual hair. If you look down at your arm, right, that part of the hair is referred to as the hair shaft. So if it's above the surface of the skin, it's the shaft. If it's below the surface of the skin, it's the root. And at the base of the root, that is going to be the hair bulb. Now, at the base there of the hair bulb, you'll have this structure that comes in. It's going to have these blood vessels and whatnot, okay, that enter and exit. All right, the hair bulb, that is the hair papilla. So when we're talking about an actual hair, we have a couple different components that make up the human hair. You've got the matrix, which is the actively growing region of the hair. That's where the cell division is occurring. So that is going to be made up of new cells. So that will be where the living cells exist. And so the older cells get pushed towards the surface of the skin. At the direct center of our hair, we have the medulla. All right, that is going to be made up of softer keratin, so it'll be more flexible. Then surrounding the medulla is going to be the cortex. All right, that's going to be harder. That's going to give hair more of its rigidity. And then there's a single layer of cells that cover the cortex, all right, and that's going to be the cuticle. That's what we see when we're looking at the hair there. So if you look here at this picture, you zoom in, you can see, all right, this dark brown, not dark brown, but this brown structure at the center of the hair, that's the medulla. Surrounding that tan region is going to be the cortex, and this dark brown that covers the whole exterior of the hair, that's going to be the cuticle. All right, two other parts that are going to be associated with our hair is the hair follicle